Hello and welcome to the Healthy Education Podcast, coming to you out of health education at the Athens City County Health Department. I'm your host, Ward Bryson, the ComCore member serving with the Health Education Department this year, and I am supported by Logan Lambert behind the scenes, our sound tech, who is a ComCore member serving at Nelsonville York Schools. The goal of this podcast is to sit down and have a conversation with people who are working and serving in Athens County in order to get a better understanding of the contributions that they make to the community and how those contributions bring us towards healthier futures. This podcast is based out of the Health Education Division at Athens City County Health Department, which works to make the health choice the easy choice through policy, system, and environmental changes. Logan and myself are both serving members of ComCore, a local state national branch of AmeriCorps based out of Ohio University's Heritage College of Osteopathic Medicine, which places members throughout Athens County in order to contribute to community health in a variety of ways, many of which we'll examine during this podcast. Today, our guest is Ruth Dudding, the Director of Community Health and Engagement at the Athens City County Health Department, and my supervisor. Hello, Ruth.
Hello, Ward.
Ruth, can you tell us a little bit about your role at the health department?
Sure. So part of my role, it's kind of a new role. I've only been in this role for about 7 years, and I've been here for 22. So that's why it feels new to me. But I supervise all the health education activities at the health department, plus trying to make sure that the work that we do is work that engages with the community. So that's the community engagement part, making sure that policy, systems, surveys, any kinds of program implementation are things that are decided with the community.
Okay. You said you've been with the health department as a whole for 20-something years?
22.
How did you find your way here?
Let's see. I actually applied for this job and didn't get it the year before. Yeah. And so something else became available because they had hired a health educator, and then they were getting ready to write for another grant, and they just kind of blew the dust off of my resume and called me, said, "Hey, you want to re-interview with us at the health department?" And I said, "Sure." So that's how I found my way here.
Okay. And did you find your way to Athens by way of OU?
Yes, I did.
Okay. Where you studied public health, I assume?
I did. My degree is in community health. So that's what it was called. Now it's community and public health. But back in the day, 1987, it was just community health.
Okay.
Yeah.
Okay. And you've been a hallmark. Really, I call you a local celebrity because you do have a radio show.
Ooh. Is that all it takes? All right.
Well, I feel
that means you're a celebrity because you've got a podcast.
That's like an online celebrity versus like a radio celebrity. I think they're very different. I do think you carry yourself like someone with a radio show. You seem like you're used to speaking into a mic. You're used to, although you do it from your phone nowadays, right? We
have been doing it from our phones. Yeah.
Whatever. You seem official when you're coming in to record this with us.
Thank you. Thank you. That was very kind. You're very professional yourself, Ward.
Thank you, Ruth.
You're welcome.
Well, I'm sure most of our listeners know who you are, and we've gone over a little bit to give them an idea of your history here. Our episode today is about public health, so let's get into the meat of that.
Okay.
The big question, what is public health?
I knew you were going to ask me that question, so I went to the CDC, the Centers for Disease Control and Prevention, because they always say it just right. So public health is actually a science of protecting and improving health of people and their communities. So public health is actually this umbrella term for all of these actions and efforts, policies, infrastructure that just support people's health and prevent illness.
Okay.
Yeah, so it's like if a doctor does, focuses on a person's health, public health focuses on a population's health, a community's health. So, and it's really focused on prevention.
So preventative health at a societal level, kind of.
Yes. And an upstream approach. So trying to make sure everything is set up in such a way that you're going to have the best health possible. So most of the time people don't even know what public health is because they don't see it until something goes wrong. If there's a disease outbreak or there's a maybe a foodborne illness in a restaurant, then people see what types of public health things can go awry. But as long as everything is flowing along swimmingly, it's almost invisible. But public health is just about everything that we do every day.
Okay, so 3 years ago, when you had said most people don't think about public health.
Okay, they do now. You're right. Okay, everybody knows about public health now.
Because things are not
right.
going swimmingly. Okay.
Yeah, you're right. You're right there.
You drew your definition from the CDC.
Yes.
And we are ACC-HD, the Athens City County Health Department.
Right.
And there's also ODH, the Ohio Department of Health.
Right.
How do all of these bodies interact and kind of connect?
They really are connected in a way that the Centers for Disease Control and Prevention often supports research and grant opportunities that each state's Department of Health may apply for or may draw down from, that they can then share with local health departments. That's one thing. But again, I think in terms of the pandemic, we really took marching orders from the Centers for Disease Control and Prevention. When they said the time was right to do XYZ, then we did it. So the health department, the state health department, the Ohio Department of Health also does provide a little bit of subsidy. So merely because we have a health department, we get less than 25 cents a person from the Ohio Department of Health every year, about $16,000 for our prevention efforts. So we are mostly supported by grants that come also from the Ohio Department of Health. And the grants that we have here specifically are around maternal and child health and creating healthy communities. Again, making the healthy choice, the easy choice, prevention, thinking about that prevention focus. But then other than that, the good people of Athens County support the health department as well, because we are levy funded. Not every health department is. So we have kind of those three streams. We get a little bit of subsidy from Ohio Department of Health. We get several grants, and then we have this, again, the wonderful support from people through levies.
It's really interesting to see how our department specifically plugs into, above us and like the hierarchical kind of government level, and then below us to the people that we're serving. Is there any horizontal connection? Like, do we connect with the health department in Meigs County, for example?
We, on kind of an operational level, like we used to in the old days. In the old days, we sometimes we shared funding. We would get larger grants for a region, and so we worked together in that way. And that's still possible when those grant opportunities arise. But sometimes we have a grant that other health departments around us have, so we might collaborate on that. Every health department has a public health nurse, a director of nursing, or public health nursing services and environmental health services, and those folks talk to each other about what's happening all the time. So yes, in kind of a friendly, casual way, but not in an operational way.
Okay.
Unless there's a grant involved, and then we work together that way.
Okay, that makes sense.
Yeah.
The reason that we're talking about public health today, and we are a little bit late, but last week was Public Health Week. What is the significance of that to our department, and what do you feel is the significance of that to you?
Okay, well, first of all, even though last week was Public Health Week, really, Ward, every day is Public Health Day. Every week is Public Health Week, because it never stops happening. But we do get a week a year to kind of elevate the awareness of what public health is. And there is a National Public Health Week website that I would encourage people to go to. It's National Public Health, nphw.org. And there's lots of good information there. Lots of information for our health departments, for community members, just about public health. And every year there's a theme. So this year's theme was Public Health is Where You Are, which I love that theme, because public health is exactly where you are, whether you're at work, whether you're at home, whether you're having fun with your family in a park or, eating out. All of those experiences, no matter where you are, you're interfacing with public health. So we had a little bit of fun. So it's once a year where the public health geeks get to, step out a little and have a raffle or something, But we just shared some information on our social media every day about each department, introduced the staff and what each, department, who works in that department. And then also we drew in some national public health themes, like around collaboration, around race as a public health issue. So we shared those national themes and then a little bit about what we do here at the health department. So, because not every health department is the same.
Yeah, for sure.
Yeah.
I'm curious, could you speak more to race as a public health issue?
So I would love to do that because it's really a focus that we're trying to be more involved with. And again, when we talk about public health as an upstream policy system and environmental process, we know that there are a lot of processes, whether they're cultural or systemic, or maybe both, that don't support every person equally. And so we are learning more about that. In fact, we're working with the Racial Equity Coalition here in Athens County to really drill down and talk to folks about how they access healthcare, how they feel about their relationship with their healthcare provider, how they feel about the questions we at Public Health ask in our community health assessments. So right now we're trying to really listen and learn from everybody about what that looks like, what our assessments look like. Are we asking the right questions? How do the questions feel? And what else should we know that we're not really looking for? So, but racism as a public health issue is, again, so many things. It could be, maybe your workplace doesn't have a policy where there's a board representative of everybody who could be working in that particular business.
Well, you could say that, not understanding differences in people's bodies, like black hair is very different than white hair, and the care needed for that is different. Or you could talk about, even, this isn't racism, but other issues of diversity, like people may not understand what LGBTQ individuals might need in a space.
Exactly.
So you're talking about bringing in those other voices to kind of, especially in an area like Athens County, where it's pretty homogenous, and there may not be consideration given to people that are different.
Exactly. And that's kind of my role too. My newish role is that engagement piece. Like, are we hearing from everybody in the community? So, yeah.
Great. That's important.
Good question. Thank you.
We touched on COVID a little bit and how it has really brought public health into the limelight. Do you feel that public health as a whole, in a very general sense, has been altered or changed drastically through the process of going through COVID?
Absolutely. I mean, public health is, most public health departments, let me say that, are a government entity. We're a political subdivision of the state. That's kind of our designation. But people see us as government because there are laws that we support and follow. So I feel like public health has become more political. And that's been an interesting process. And so, I don't know. I think that people are more aware through the pandemic what public health does. I also think that people are more, feel strongly, more strong, I should say, about the principles or practices that they believed in before, probably more strongly than they had before. So one thing I think that if there's a silver lining about the pandemic around public health and the community is that I think people do see themselves more in their public health role. And I think that public health sees people more as a partner in public health. I remember when there was a potential shortage for masks, that community members were the first ones to say, well, we're going to make some masks. We're going to get these masks out before even the CDC said or recommended that people should wear a mask. People in the community were making them and distributing them. So oftentimes I feel like, it's people in the community who are the experts in public health, and they're the experts in implementing public health. And I think we really saw that with the pandemic as well, that people were ready to jump in, and they had a lot of expertise, and they had a lot of good ideas. PassionWorks created beautiful artwork and messaging and stickers for us. We had many partners who were sharing information, really that supported the health department. So I think partnerships have grown, have flourished. Maybe had always been there, but they really blossomed under the pandemic because we needed each other. And I think the value of the expertise of the community has really been elevated through it as well. So
that almost is what I'm hearing. That's touching on the same idea that you spoke to, talking about racism as a public health issue. Is it's listening to populations to speak for themselves. Right. And that could be a geographic population. That could be the Appalachian population around here, and understanding what makes our community our community.
Right.
Speaking of our community, we've been talking about public health in a general sense. Would you be able to give us an analysis of our public health department,
Sure.
the Athens City County Public Health Department?
Yeah, like a walkthrough.
A
day in the life of Athens City County Health Department.
Well, I think probably we should start with something banal and not very important. City County Health Department. Is it a city health department or a county health department?
That's a great question. So we are what's called a combined district, because other communities have a city health department, and then they might have a county health department. So you might have Columbus Public Health as a city health department, but then Franklin County Public Health is a county-wide. So, but we're combined, and I don't remember the date. I should know the date. It was long before me that
this isn't a history podcast.
Okay, good. So it was a long time before I got here that the city and county district were combined. But it's interesting that so many other counties have still, more than one health department. Even Washington County has Marietta City, Washington County Health Department, and a Belpre City Health Department.
Oh, wow. So
yeah.
3.
Yeah.
Interesting.
So we are just one in Athens County. We're all you got. We're the city, and yes, we're the county. So.
Okay. And you mentioned earlier that every health department has nursing and environmental health.
Right.
We also have those functions here.
We do.
Can you talk a little bit about what each of those handles?
So many good things. And I think it's interesting when people, their interaction or their interface with the health department is like typically through one of those channels. They've come here for immunizations. Maybe they've come here for a clinic that public health nursing offers. And they do a lot. Boy, through the pandemic, people knew what, public health nursing did. But we talked about environmental health too. Environmental health is kind of the regulatory arm of the health department. So they kind of look at following the public health laws, what's in the Ohio Revised Code around food and restaurants and
so individuals may interact with our nursing branch more, whereas businesses may interact with our
environmental health. Unless you're building, like if you're building your own home, you would call the health department around sewage plans and just looking at building sites and things like that. Okay. So, yeah.
And those aren't the only things at our health department either. What other divisions do we have here?
We have a dental sealant program. So we do have a dental hygienist, who goes out to all the schools in Athens County and provides dental sealants. We also have a policy and planning department. We have a person. It's a department, but it's also a person. It's court. And so court is really involved in making sure that our strategic plans are in place, our community health assessments take place, that our trainings are on time, and the workforce development. So it's really kind of shoring up the staff development as well as assessing and creating plans for the community based on those assessments. So that's policy and planning. And then we do have a emergency preparedness person, Kate Cottrell, and while she wasn't the only one, we did have Dustin Hubie was our emergency preparedness person before Kate through the pandemic, but she is here now and doing a great job. So that's wonderful as well. And we have a health education department, the rockinest health education department in Ohio. But
you're not biased at all.
Not at all.
Not at all.
No, very good. Yeah, and again, these are the folks that really focus on creating policies, systems, and environmental changes to support the healthy choice and make it the easiest choice, and mostly around food and physical activity or recreational options, and maternal and child health and adolescent health.
Okay. And not to drag on about COVID, I know no one wants to hear too much about COVID, but I know that the health department was in a state of ICS, of Incident Command System, before I started. How did that change the landscape of how the department functioned?
Well, that changed everything.
Okay.
That was completely, one day you thought your job was one thing, and the next day it was completely, like, every person in the building at one time, at one point in the pandemic experience, was a case investigator, a contact tracer. Maybe we're working at immunization clinics, maybe testing sites. We just did not do our regular normal job.
Yeah, so these people were nurses, sanitarians, health educators.
Yeah. Once we went into, you mentioned Incident Command System, ICS. So once we entered into that Incident Command System, then we really evaluated what was needed in the community, what was needed to happen here in-house to kind of serve the community, and those roles were adapted. Before the pandemic, we all had, emergency preparedness roles. So I have been practicing for years as the public information officer, and Mike Cooper is also public information officer. But there are others who are like the safety officer, a liaison for this, that, or the other. So we all had kind of these sub roles, and we had plans for emergencies and pandemics that we practice each year. So it wasn't completely new to us. But the fact that it lasted so long was what nobody really expected. Because when we would practice, it'd be like, well, let's start this at 9:00, and by 11:30, right, the flood emergency is cleaned up and everybody's out of the hospital and everything's fine. So, so that is very different here. So I think what the change is that, people who did inspections every day, or, we have the nursing department has a welcome home baby program and all these other things. They also have a harm reduction clinic, which actually almost the entire time was able to continue. But all of those day-to-day things that people normally did were suspended. And in fact, the Ohio Department of Health issued an allowance, a formal allowance for grant folks to do the work that I just described. Wow. For health departments. So if you were on a grant, it was acceptable for you to be able to support your community through the pandemic. So we were really grateful for that, because we were all hands on deck for sure. Because there was a point in that experience where people were here every single day, every weekend, every single day, holidays. It just, that, because there are laws and rules about, how quickly you need to respond to someone who has been identified in a pandemic. So, it was intense. And so it's really interesting being in the space we're in now, kind of coming out of the pandemic, because it's like relearning your roles, like, and everything has changed. Like, people did not hold things for us for 2 years, right? So there are new things in health education There are, new restaurants, and there, it's just very new.
Yeah, there's also new ways of meeting. Zoom. I know
It
a lot of
is,
the
yeah.
coalition meetings and committee meetings that we have are over Zoom now.
Yeah. And there are definitely silver linings, and there's new ways to work at home. If you want to work at home and you have the capacity, every person who works at the health department now has software so that they can make a phone call from their computer and it looks like it's coming from the health department. So those accommodations were kind of made so that people, at least when they worked their weekends, could do so at home. But it's part of the silver lining that we get to enjoy still. So.
All right, shifting back away from the pandemic, I am curious. You talked about listening to community needs and kind of plugging into community members. What are the different sorts of committees or coalitions that the health department connects with in our community?
So there are a lot of them, and I'm not going to be able, off the top of my head, remember them all. But we host the Creating Healthy Communities Coalition. We're also part of the Athens Hope organization. I know that Age-Friendly Athens County is something that we're regularly involved in. Racial Equity Coalition. Oh, Ward, that's a big question. There's a lot of them. There is a lot of them.
So we are everywhere, is what I'm hearing,
well,
and helping with a lot of things.
I think more importantly, that we're not the only people doing public health. I think that's the message there, is that there are lots of organizations doing good work around public health.
All right, so that makes sense. Maybe this will be a little bit more straightforward. Are there any other governmental bodies that we plug into for help? I'm assuming that our regulatory arm, as you described them, environmental health, might plug into law enforcement? Or
They do. Actually, they do work with the Sheriff's Office on a few of the programs that they work with. We work with... are you asking me if we work with other organizations?
Yeah.
Oh, so many other organizations. I mean, because those coalitions that I just mentioned, there are many, many, many organizations involved in those as well. So, yeah.
And that almost speaks to, I would say, from serving in Athens County, the Athens County experience of, half of the people that you talk to that are serving and working in Athens County, they're doing 2 or 3 things, and then they're networking those things, and just everybody's connected in 10 different ways.
That is true. That's really the great part about being in Athens County, I think, is that, because we get to interface with our statewide partners who are also involved in the grants and the work that we are involved with. And, I think being a little bit isolated, rural, has its advantages, because we need each other. These resources work together because we need each other. And that, I don't want to say dependency, because I don't think it's dependency, but that situation, that condition is really helpful because it builds relationships. And that's the foundation for all work, really. There's people, right? And so we have good relationships with people who work in organizations. And I think somebody told me a long, long time ago, when I started working at the health department, that nobody's coming from Columbus, Ohio to come and solve the issues here in Athens, Ohio, Athens County, Ohio. So we do depend on each other. We do need to work together. So, and I think I highly value that as well. So, yeah.
Okay. That's a great answer. I think I really have one last question, and I don't think we've touched on it, is that, because you've talked about us being in an isolated kind of rural area, how does the presence of OU impact the way that we serve the community?
I think that Ohio University is a great partner for us. They really provide a lot of expertise around evaluation and grant making. We have had, we have a community health worker program here at the health department, which I didn't get to talk about.
Would you like to?
I would. But I will say, let me answer your university question here first.
Okay.
So the university itself supports. We couldn't, I mean, some of the best collaboration we've ever had through the pandemic has been with the High University, and getting to do vaccination clinics on campus, getting to use students to support the many bodies that we needed to kind of run the thing. But High University is also a community, right? It's not a city, it's not a township, but it is an entity. It's a population, it's a community. So, we care very much about what happens to students there. We consider them community members. So as long as you are living here during your university experience, you're part of our jurisdiction, and we want you to have a happy and healthy life here. But it does, like I said, provide some more resources that we wouldn't have had. And I started to mention community health workers because we get some financial support, or we have in the past some grant funding to support community health workers.
Who are our community health workers? What do they do?
Margot Baker is one of our community health workers, and Sherry Blackwell is a community health worker. And our two community health workers really focus on people with high-risk diabetes.
Okay.
So they get their referrals from multiple healthcare providers in Athens County. And essentially, they just help them understand what the plan is that the doctor has for them, and figures out ways with them to kind of make the plan happen. So people, I think, would be surprised that most of the time the things that make it difficult to manage something like diabetes has nothing to do with food or even activity. It has more to do with transportation to the doctor's, finances to be able to pay for those test strips or insulin or medication, or just confusion with how to apply for programs like that. So there are a lot of social determinants or social drivers that affect people's ability to live a healthy life. And that's what community health workers do. They're advocates for people to help them manage their diabetes. So they're fantastic.
Amazing.
I mean, I wish you should do a podcast with community health workers.
Okay.
You would love it.
Put that on the list.
Yeah.
Ruth, do you have anything else that you'd like to plug or shout out for our community before we close?
Yeah, I do. I'm just really in awe and really grateful for partners, community members. Like we can't do the work that we do without people. And I said this before, but I just want to reiterate that people are the experts in their community in the way that things should be. And we just want to honor and respect your knowledge and want you to know that we're a partner with you in health. And so we're open to hearing what you have to say. You can give us a call at any time. You can call the health department, 740-592-4431. Ask for Ruth. You can call me, talk to me, and tell me what's going on, and we'd love to work with you.
You could ask for Ward, but I'd probably be a lot less helpful.
He would just pass the phone over to me, right?
Honestly, yeah.
But we also have a great website, www.athenspublichealth.org. All of our services are on there. Many of the forms that you might need. We didn't talk about vital statistics. I would say most of Athens County at some point is going to come to the health department for a birth or death record. And those forms are right there on the website. You can fill them out before you get here. So, yeah, if you really want to deeper dive into the inner workings, go to the website and you'll see everything there.
Great. Ruth, where can we listen to you on the radio and when?
Every Wednesday morning, Make It Happen with Kim and Ruth. It's not just me. Kim Valentor is also there. WATH.
Okay.
Yeah.
Thanks for being on the show, Ruth. We really appreciated it.
Yeah. Thank you for inviting me. You know I love to talk about public health because it's my passion.
Well, we really thought that you brought a lot to the table today.
Well, thank you. I appreciate it.
And thank you to our listeners for tuning in. We hope you enjoyed today's episode. We will catch you next week with a couple of guests from CFI.